Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call.
Hi, everybody. Welcome to Healing Families Shattered by Addiction. I'm Brian Jackson, and I'm here with my partner, Di McQueen. And this is a tools and techniques podcast that we're going to talk to you about as it regards to 3 ways that addiction can affect the family and also friends. The 3 ways that it can affect us that are pretty obvious to us, but we want to discuss them with you, is it can affect us emotionally, financially, and physically. And Di and I were talking about it, and she wanted to share with you how this disease can affect you emotionally. So Di, you want to talk about that a little bit for everybody?
Sure. Hey, B, how's it going?
I'm good. Good to see you.
Just, to do these things with you. So, yeah, I mean, addiction is so insidious, isn't it? And, most people don't really realize the effects it has on us, on our mind, body, and spirit. So I wanted to talk a little bit about the emotional side of it. And for starters, let's face the obvious one, right? Which is the trust issues that it causes. It's really common for people when drug abuse is involved or alcoholism is involved that we have partners that may not be so honest, right? And then it begins to, impede how we trust and feel like we're being manipulated, we're being lied to, and et cetera. And it's really a difficult one when, trust begins to be broken. And it takes a while. We have to kind of go through that process. But as the disease actually, is moving along, the trust becomes much worse, right? Because we know that there's a lot of lying, there may be stealing, there may be, making up stories of where they are and not really where they are, stating they're with friends that they're not really with, but the trust. And that's a big one, and most of us don't do well when trust is involved, and it's broken. We can get into many, many arguments because, again, starting with the trust part, then we start asking questions. And as the family member asks questions, typically the addict may get angry, right, and start accusing you of things. And, then the family member gets excited and emotions begin to run really high, and we get, volatile. We say things we don't necessarily mean. Sometimes it's the addict is actually doing that purposefully to kind of, dodge the bullet and that kind of thing. So, those kind of emotions are difficult to kind of work through as well. But we also know that we see more and more of that. And I hear it from family members all the time. We never used to fight. Now we're fighting all the time. And it's a deception factor, right? If I'm mad and whatever, it gives them a reason to use and abuse. But B, it also, is that take the focus off of me and put it back on you. I'm not going to take or accept that I've done something. So I'm going to make it about you. And we begin to have the dance. So that's a very, very big one. And I think the other one that really comes to mind, in addition to the things that we'll talk about in a moment, is the attachment, right? When someone you love is having an affair, quote unquote, with their drug of choice or alcohol, it really does make the children, the spouse, the friend feel like they've been abandoned or neglected. And in fact, they are to some degree, right? Because they're actually vying for attention from this drug of choice, and they're not getting what they need because the attention really isn't on them. It's on how do I get to where I need to be? So I'm going to do that any way I need to. And therefore we have a lot of emotional turmoil. So, I think back to my own self when I was in that place, and it was those things were the most profound kind of emotional, areas that I can think of. But there's also I'm drained all the time, right? Emotionally, I'm like spent. And so I'm really flatlined, and I'm going through life kind of like I don't really know if I care anymore. Sometimes I'm like hypersensitive. Other times I'm like deadpan and not really understanding what is happening to me. I can remember being really sad, but not knowing why I was sad. Going like, I'm just trying to get through this day. And, those types of emotions, like it doesn't make sense. I can be very anxious. And, now I start to turn the corner to go home, and I can remember my anxiety levels going through the moon, going like, what am I going to find today? What's going to happen today? Is it going to be a good day? Is it going to be a bad day? And again, putting all of my eggs in that basket, right? Like he is in charge of what I'm feeling, which isn't the truth. But at the time of not really understanding what's going on, I felt like that was the truth, right? He controlled all of my emotions, until I learned that that doesn't have to be that way. But that's kind of the things that, began me to understand that like there's nothing really left in the tank. And that cannot be good nor healthy. And what am I going to do about that kind of thing? So that's the area of emotional. I don't know. How do you feel about that? Emotionally, you feel the same way?
Yeah, exactly, Di. I mean, it's, giving up who you are, giving them the prescription for what they want at your expense. And it's very difficult to figure out, as much as you try to, how to get out of that situation. And it's very, very uncomfortable. So, the reason that, we're talking about this today is to hopefully make you aware of these things, and that, you need to take some action that's healthy for yourself, because it's a very unhealthy emotional relationship, and it's difficult. There's no doubt that it's difficult. And that kind of dovetails into like how it affects family and friends financially. The person who is, using alcohol or drugs, and it's really become, the main, event in their life, can cause, trouble holding down a job. People will say to me, oh, well, I never drank or drugged at work. But however, if you were up all night drinking and drugging, you start to, at least in my experience, see people not performing as well at work. They may not show up for work. And that can lead to, real troubles, especially in trying to stay employed, which as a result, if you're not employed, anybody that's relying on that person, financially, is, affected, as a whole family unit. And therefore, can cause a lot of stress and worry. I mean, financial stress can lead to some real problems, with paying bills, etc. And as the addiction worsens, and buying drugs or drinking alcohol becomes their priority, nothing else is getting taken care of. That's the number one priority. So, addiction can lead to different ways for the addict or alcoholic to get money. And unfortunately, that can be stealing. It could be stealing from you, pawning things that are in the house to get the money, kind of behavior that the person normally wouldn't do out of character for them have they been sober, and you've seen their behaviors in the past. It's just so out of context in your mind as to who this person is and what the addiction has led them to become. So, getting money for drugs and alcohol becomes, at any cost. And that's, a lot of times family members will, give money to the person who is, suffering financially. And a lot of times, because the addiction is so manipulative, they can work on you in ways like, I have to pay for this, I have to pay for that, where in effect, what they're taking is the money and using it to perpetuate the disease. I mean, the good news about it is if that person gets into recovery, I've met employers who say this person is on their last chance agreement as a result of their absenteeism, as a result of their, lack of performance at work. When they do get into recovery, many times I hear from the employer after the fact is that this is the best employee I've ever had. So it's not hopeless. I've seen marriages dangling by a thread where the person gets into recovery and their marriage becomes better than ever. So it's not completely hopeless. However, it's very, very frustrating when they're in the midst of their addiction or alcoholism, in terms of their behavior, how it affects everybody. And, we all get sucked into the addiction, in terms of how it affects everybody, not just the person who is using. And that can manifest itself, because of the stress, to physical effects that it takes on you. And I don't know what you've seen. I know, well, maybe we can share what we've both seen in terms of how people neglect themselves and end up with some physical problems that, are a direct result of their loved one's use that sometimes is outside of their awareness.
Right. I mean, let's start with just what you just said, right? The chronic stress. We all know that chronic stress can, show itself in a myriad of ways. And that can be things like heart attack. It can be, I can't function. It can be, I have other issues that are going on now because my body goes into, panic mode on the regular because I'm so stressed out, or, I can't get out of bed. Strokes, all of these things, asthma even, they begin to understand cancer. Those things are often due to chronic stress. And people go like, oh, that really can't happen. But in fact, it can happen, and it happens all the time. And let's go to the farthest extreme, right? Which is the stress on the body can lead to depression, but it's not just for the person themselves. It could be the wife, but the kids, if this person happens to have children around, the stress on those children of knowing, like, what am I going to have today? Should I be scared? Should I not be scared? Do I need to be out of the house, in the house? Should I be protecting my mom? Should I be protecting dad? Those things are very, very stressful for children, and something a child should not have to deal with or worry about. Which then leads into the depression. When we get so stressed out, it then begins to wear on our body, from the physical standpoint, where we get depressed. And depression, of course, is a whole myriad of things that go on that we're not doing physically. For instance, we might not be sleeping. And that we know long term is not good. But more importantly is that, I might be like stress eating, and I might be doing things like gaining weight or losing weight. I might be not showering because I can't even function anymore. And so I'm not taking care of my own grooming needs. I'm not going to the doctor anymore because I think I need to be around the house to make sure that that person doesn't do anything to my children. I may be, coming to terms with all of these things that are really detrimental, mood swings, all kinds of stuff that happen that can be really stressful and hard on my body. I don't go to the dentist. I don't go to the doctor. I'm not getting my hair done. I'm not doing the things that I physically need to do to maintain my day-to-day health and well-being. And of course, then there's that last one that I think I'll allow you to kind of talk about, B, when someone begins to get so out of control that they start to act out and become, physically violent.
Yeah, and the acting out and the screaming and the hollering, is really not productive. And, sometimes you'll spar with them trying to get your point across, but it's not really being heard because you're talking to the alcohol or the drugs. And that's why it's so important to not enter into those arguments, discussions, whatever, while the person is active in their addiction. And just to kind of talk more about the depression part of it, you think about the constant stress, the constant ruminating, the constant frustration about why they don't make changes. Because when you're looking at it, it's like, why don't they just stop? And so therefore, we talk about flight or fight or freeze. And what we see with families a lot is that they freeze, kind of like what Di was saying, that, we don't take care of ourselves because we're frozen. And sometimes we're making our happiness contingent on whether or not the person gets help and gets into good recovery. But in the interim, it's real important to pay attention to how you're taking care of yourself. What's your self-care like? Because you're not going to be able to control this disease, but you can control the decisions that you make for yourself without giving your happiness over to whether or not, as I said earlier, this person gets help or not. So it's really important for you to break the cycle. They're making choices, right, for what they're going to do and what they determine that they're going to do, whether it's outside their control or not, because of the power of the disease. However, we're not powerless over choices that we make for ourselves as family members to try and disengage from this roller coaster ride of addiction that just permeates the family and how everybody interacts with each other, and more importantly, how you interact with yourself. So it's just so vital that you start to try and focus on eating right, treating yourself to, as Di said, getting your hair done. If you don't want to neglect your health. But I understand, and Di and I both get it, that you ruminate about this, like who's coming through the front door? Are they going to stop? Are they going to take something from us? Are they going to hawk something? Are they going to come in screaming and hollering? So again, we can help you, with tools and techniques to set boundaries and cope with this situation in a healthy way for you. So it's real important that you don't let this continue to go on forever and ever and ever, because the addict or alcoholic may never change, but in the interim, you're going to pay a price. And we see people with post-traumatic stress disorder, which could be a long-term consequence, of, for kids growing up, with an addicted or alcoholic parent. And, we don't want them to be in a place where they have to, be in therapy, 20 years later, trying to overcome their dysfunctional childhood. So, but again, those are three ways that, addiction affects the family. So, we're here to help in any way that we possibly can. We have a lot of experience with this, and we've seen a lot of family members get healthy if they take the suggestions that we give them and apply them to their lives. So please feel free to contact us at any time at info@Family and Addiction Experts. That's our email address. Or you can go to our website at familyandaddictionexperts.com. Fill out a form, and there's no one template for each family. Everybody's different, so we're more than happy to have a free consultation with you and see if we can give you some direction or we're a good fit, and see what your willingness is in terms of trying to alleviate this pain emotionally, financially, and physically that you're experiencing. So we think this is a great topic, and we will be having more podcasts touching on addiction, what it is, etc. And we will have some special guests on that can speak to this as well. So thank you so much for listening today. And again, this is Healing Family Shattered by Addiction. You can find us on Spotify, iTunes, YouTube. But again, there's a direction or a click on that you can do on our website that will take you to our podcast. So Di, thank you very much for today and your insight to the way these three things can affect the family.
Thank you, Brian. Just the last little bit, in addition to all those things you said, remember, you're not alone in this journey. We understand where you've been because we've lived it, we've learned it, and now we want to teach it to you. There are solutions. Please join us. Healing Families Shattered by Addiction.
Thanks,
Bye.
Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.